And the quickly spreading Delta variant is causing an increase in COVID cases among kids. What's the latest on the vaccine timeline for kids 12 and under, and why are some parents seeking it for their young kids now?
Dr. Richard Kang is the medical director of the pediatric ICU at Dignity Health Northridge Hospital. He's joining us now to talk about the latest headlines. Doctor, thank you so much for being with us this morning. The latest stats show that nearly 500,000 children in the United States tested positive for COVID in the past 2 weeks. And since most of the kids are now back in school, what can be done to contain these outbreaks?
So I think LAUSD, at least for the most part, has taken the advice of the CDC, and one of them has been the mask mandate. Ever since the beginning, wearing masks has been the best way to prevent the transmission of the virus, and that's why I believe LAUSD implemented that, as well as weekly testing. So my son goes to middle school and my daughter goes to high school, and both their schools do weekly testing, and there have been cases that have been caught and students that have been potentially exposed to positive students have been quarantined right away. And that's the best way, I think, to help contain any type of spread within the schools. And obviously, the AAP recommends all children 12 and older getting the COVID vaccine, and that'll be another tool that we have or weapon we have against the virus and the spread of it as well.
Yeah, the vaccine's the big tool we have, doctor, but if you're under 12 years old, it's not available to children that age. It sounds like some parents, though, are still pursuing it. What would your concerns be with that?
So I think the main concern is the dosing. The children 12 years and younger may require a lower dose depending on the efficacy of the vaccine. We don't know the full side effect profile as well for children under 12, and that data is about to be submitted by the vaccine companies, including Pfizer. So we don't expect any approval for emergency use probably until the middle of the winter.
And doctor, a common question we're getting, does your booster shot have to be from the same company where you got your original? So if I got Moderna, do I need to get a Moderna booster shot, or could I get a Pfizer booster?
So again, the CDC recommends, if you can, to get the same. Well, you should stick to the same type of vaccine, because there's no studies to prove different types of vaccines work. But in terms of the mRNA vaccine, which is the Pfizer and the Moderna vaccine, if you can't absolutely get this vaccine from the same company, it's okay for now to get, let's say you got the Moderna, it's okay to get the Pfizer. The thing that they recommend against is getting the Johnson & Johnson, because that's a whole different type of vaccine. So it's not an mRNA vaccine like the Pfizer and the Moderna.
Yeah, it's more of the traditional kind of vaccine we're used to from the past.
Exactly.
Great information, doctor. We certainly do appreciate it. Thanks for your time this morning.
Oh, thank you for having me.